ask Miss Jones, do you feel any pain or pressure? Definitely just want to make sure that you have a good square knot for Welcome to MP Skills Made Easy workshops. So this session is really to show you the various suturing techniques that we perform in primary and urgent care settings. You want to wait and make sure that the patient doesn't feel any pain or pressure when you start. And particularly pain. So you want to ask Miss Jones, do you feel any pain or pressure? And you want to make sure that you go over the wound margin. And of course, you go in the wound as well, just to make sure that the patient has no pain while you're poking the patient. And so this will take about 5 minutes. And so the next thing you want to do is to go ahead and open up your suture. So that's your suture material. So I'll just go ahead and open that up. And I will grab my hemostat. And now I have my sterile field, so I can go ahead, of course I have sterile gloves as well. So I'll just go ahead and open up my suture material and my needle. So I want for you to take a look and see how you you're able to load your needle. So you have your tissue forceps, and of course the first time you can use your fingers, threads from behind. So make sure that once you load your needle, you have your hemostat locked. Okay, so that's something that you want to practice. Again, like I said earlier, make sure that you have that muscle memory of opening and closing your hemostat. You're ready to suture. You've cleansed this, the laceration. You've, of course, you can use your normal saline. You can use your sterile water to irrigate the wound and make sure that the wound is ready to be sutured. There's no foreign body, there's no dirt, there's no debris. So again, now you're ready. So with suturing, there are a couple things that I want for you to keep in mind. So, again, once you load your needle and your hemostat and you have your tissue forceps, the next thing you want to do is to take bites. So this is a laceration that we'll be repairing right here. And the first technique that we'll be discussing today would be the simple interrupted suture. So the first thing you want to do would be to go ahead and you're going more proximally, more distally. Just go ahead and take a bite. So I make sure that I take at a 90-degree angle, and I go to the opposite side and I take another bite. And I want to be sure that my bites are equal in width and in depth. And here I'm just going to pull through till I have my, so that's my 1-inch tail right here. And so once I have my 1-inch tail, I'm ready to wrap around. So I have my hemostat in the middle of 2 threads. So my tail, my little tail, and my long tail, my needle driver should be in between the 2 tails, perpendicular to the wound. So now I'm ready to wrap around. So I'm just going to wrap around once, round the hemostat. Second time, I open up my hemostat and I grab, and the tail comes towards me. So nice and flat. And then I wrap around for the second time. I pick up my tail, and for the second throw, and so I have a 3-0. So the first time, so I'm just going to wrap around 3 times. Throw, the tail comes towards me. Okay, so now I have a perfect square knot, so I can go ahead and the thread. And so when you're trimming the thread, make sure that you leave at least a 1/4 inch tail left, so that when you're taking out the sutures, the person coming behind you is able to take out the suture. So that's my one suture, simple interrupted suture. So I will put in 2 more to show you how this is done. Again, I'm just going to go ahead and pick up my needle. I'm using my hemostat to grab my needle. I'm going 2/3 from behind. Okay. And now I'm going about 2 to 4 millimeters away from my first suture, picking up my skin, and I'm taking equal bites. And I go to the opposite side. I want to be sure that I have the same bites, so equal bites in terms of the width. So again, I can set down my tissue forceps till I have that 1-inch tail, set down the needle, and then wrap around twice for the first throw. So 1, 2, pick up the tail. For the first time, the tail comes towards me. Make sure that it's nice and inverted, okay? The second time, pick up my tail goes away from me. For the third throw, pick up my tail comes towards me. Okay, so now I have 3 throws. I'm ready to trim my thread and then move on to the next suture. So again, making sure I have enough tail left behind. And so if you're really wanting to make sure that you have all the knots on one side, this is a time to kind of pull that all to one side, just to make it look aesthetically pleasing to the patient. All right, so I'll just go ahead and put in another throw. So I'm just loading my needle with my tissue forceps. You never want to touch the needle once you poke the patient. So I just load, and I'm just going to do the exact same thing. So just leave the same equal width and equal depth. I go at a 90-degree angle, and I pick up my skin, and I pull my thread so I have that 1-inch tail, and I set down my tissue forceps, and I wrap around the thread twice. 1, 2, open up my hemostat, pick up my thread, and the first time my little tail comes towards me. Second time, little tail goes away from me. And for the third throw, the little tail comes towards me. So this is a simple interrupted suture. And I'm just going to go ahead and trim my thread. Again, I want to leave enough for the pressing that will take this out eventually. All right, and of course, if you would like to, just make sure that you have all the knots on one side. All right, so this is your simple interrupted suture.
Hey, thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.